health policy experts from across the sector to discuss the intersection of these issues and the steps that we can take to drive the policy in these areas. Over to you, Kira.
Thanks. So we have 90 minutes together today. The first 60 minutes will be like presenters, and then the 30 minutes at the end will be for questions. So it'll be time for a Q&A, and you're welcome to stay for the whole time, or if you can only stay for the first 60 minutes or however long, feel free to do that as well. If you have any questions or reflections or comments, feel free to put them in the chat. We'll be gathering them all at the end to do it the Q&A for questions. And also it's really great, to have a discussion and make it more conversational between us. So we really want to hear your thoughts and reflections as well, because we all have so much to learn from each other, which is why we're doing this community of practice. Cool, and I'll throw back to you, Winona.
Thank you. Just a quick reminder as well, this is part of the Youth Mental Health Community of Practice, co-convened by Orygen and YAC-VIC. The Community of Practice brings together a network of young people and those who support them to learn about the drive change in key policy and practice areas of the youth mental health system. Community of Practice holds regular events to share information, facilitate learning, and create connections across the youth mental health sector, as well as other sectors that have a role to play in supporting the youth mental health of Victoria's young people, such as the homelessness and housing support sector. If you are interested in joining the Community of Practice, please accept the invitation that will be emailed to you following this meeting. Our first speaker today, is our wonderful MC, Kira. So I'd like to introduce her and read a bit of her bio and let her speak on her experience. So Kira is a young person with lived experience of homelessness, mental ill health, and the areas that intersect. She is a youth advocate and part of the Why Change initiative at Berry Street and Commission for Children and Young People's Health for Youth Council. She presented at the National Homelessness Conference, which I think some of my colleagues actually attended, so I'll have to ask them about that, on the young people's experience of homelessness during COVID, and has also written about her experiences in Parity 4 times, so I'll also have to look into that. Today, Kira will be talking to us about her experiences of homelessness, mental ill health, and her perspectives on what can be done to better support young people experiencing these challenges. For you, Kira.
Thank you. So I feel like often when young people are invited into spaces like these, it is to, quote unquote, share our story. And I think that's a really great advocacy tool. But I also think that young people with lived experience have so much more to add about recommendations and systems change and how workers can be doing better. So yeah, I guess I'm here today to talk a bit about my recommendations and where I see, homelessness and mental ill health and how they intersect together as well. So I have been involved in the mental health system since I was 12 years old to now. I'm now 21, so that's 9 years. And I've also experienced homelessness as a child and a young person. Being so involved in these systems for a long time, I've learned so much, and I'm doing this kind of advocacy because I know these current systems, like they've let me down, are letting lots of other children, young people down, and I want to see the system do better. I'm not wanting to diss workers. Like, I understand that workers have to run and work within the system, and they often have the best intentions, like coming to these events and doing, so much work to improve best practice. But often there's no flexibility built into the system, and there's lots of bigger policy and advocacy work that needs to be done. There's so much great work that's happening, and there's more that we can be doing to work alongside children, young people with lived experience. So I think it was actually really hard for me to think about what I wanted to say with the two sectors of homelessness and mental ill health coming together, because they've been separate and haven't been working together for so long. We've been hearing that, we work in silos and, don't interact with each other. But we should, there should be more events like this where, systems are coming together to talk and share about, their work and how we can better work together. like homelessness and mental ill health are so intersected and have a lot of similar problems, you know, like not enough beds in inpatient units, and then not enough housing and beds for young people as well. So usually young people have to have a different worker for each different areas where they need support. So for example, a housing worker, psychologist, AOD worker, and so on. And young people are trying to balance a lot of complex systems on top of their own shit that's going on and manage all these different workers that usually don't talk to each other. So we often have to become our own case manager to try and communicate between all these different workers, and it's really time consuming, and also, you know, a lot of young people don't have capacity with everything else that's going on in their lives. And it can take so long to build relationships, and trust with people, and workers should be able to support young people holistically instead of, you know, saying, oh, I can only help you with housing, but I can't help you with mental ill health or anything else that's going on in your life. And it can bring a lot of instability because, you know, there's a high turnover rate in workers and managing different systems as well. There needs to be flexibility built into the roles so workers can support young people with what they need instead of trying to make young people fit within the system. For example, like the 9 to 5 service hours, you know, as we all know, homelessness and mental health crisis, it happens before 9 a.m, it happens after 5 p.m. And having support services that aren't open after 5 p.m. can leave young people alone with nowhere to go. Yes, there are crisis numbers, but they're not your worker. You have no idea who they are. There's no relationship or trust built, and there's often such long wait times as well. And like I said before, there can be a really high turnover rate of workers. So you end up having to tell your story to new workers, and then they also get all the information through your case file that's passed along. And when young people have been with a service for a while, there can be outdated case files that get passed on from worker to worker that has like misdiagnosis or information that isn't even relevant anymore. And then this can be passed to new workers and then create these assumptions and biases about the young person before they have even got to know them or even got to speak to them about what's going on for them. I think there should be transparency between services and young people, and also, you know, asking young people like, hey, is this right? Is this still true for you? Is this, you know, what's going on for you? I think young people are there, and you know, workers are always like, oh, you know, I don't know what to do about this. And it's like, well, have you asked a young person what they want or what they see, you know, or for feedback from them? And, you know, often the time it's no. I think services can work a lot better for young people with a lived experience if we're part of creating and designing them so they actually will work for us. These are massive areas that impact young people as clients of these systems you work in. We have real expertise that currently isn't being used. We are experts in our own lives, but can also translate that into systems change. Young people with a lived experience should be involved in all spaces that affect us, like policy, advocacy, systems change, service delivery, and public conversations like these. It's important to not just listen to lived experience in spaces like this, but also the expertise from young people sitting in front of you that you're already working with. Thanks for listening, and I'd like to encourage you all to think about how you can include young people with lived experience in your work that you're doing. I'm going to introduce the next presenter, Cameron. Cameron Boyle is a senior policy analyst at Orygen, a role in which he develops a range of evidence-based policy documents across a range of issues related to youth mental health. He has extensive experience in policy development and analysis and has held senior policy positions within the Victorian and Western Australia governments. Cameron has a strong interest in psychological health and the interaction between mental health and physical health. Today, Cameron will be talking us through a Welcome Home, Orygen recent policy report on the relationship between youth homelessness and mental health. Thanks, Cameron.
Thanks a lot, Kira. Before I begin, I would also like to acknowledge that I'm presenting on the lands of the Wurundjeri people of the Kulin Nation, and acknowledge elders past, present and emerging. And also before I begin as well, thanks a huge amount, Kira, for that presentation. As much as, yes, I'd like to think that the work we do here in policy is important, nothing quite equates to the voice of those with lived experience and hearing their stories. And thank you so much for presenting. All right, Seb. So, as Kira has already stated, my name's Cameron Boyle, Senior Policy Analyst here at Orygen, and I'm here to present a little bit more information about a recently released report from Orygen titled A Welcome Home. So, before I sort of go into the meat of the report, I just wanted to talk a little bit about why we drafted this report. And first of all, just homelessness is a far wider ranging issue than we even might like to think ourselves. On any given night in Australia, it's estimated that 1 in 200 people will be experiencing homelessness in some form. And homelessness is not necessarily a person who might be sleeping rough, or it's not necessarily the very visible forms of experiences of homelessness. Homelessness in Australia is defined in such a way to include a more cultural definition. So if a person is living in insecure tenancy or in overcrowded locations, they are considered to be experiencing homelessness as well. And young people in particular have an increased risk, even amongst the population at large. Young people, those aged 12 to 24 in Australia, make up less than 20% of the population, however, are over 25% of experiences of homelessness. So acknowledging that there is this increased risk to young people, Orygen wanted to understand a little bit more about why this increased proportionality exists for young people, and to further understand a little bit more about the interaction between experiences of homelessness and a young person's mental health. So the next thing we're going to look at is some of the key findings in the report as well. So this is obviously quite a bit of a short summary, but we found that there was sort of 4 key things that just kept coming up through the research and the work. So first of all, whilst mental health is indeed a notable risk factor, there are a range of factors that can lead to a young person experiencing homelessness. So for mental ill health, there is research indicating that it is a contributing factor in up to 35% of young people's experiences of homelessness. Now, this is roughly equivalent to other risk factors such as abuse, poverty, and youth delinquency. It's only family conflict that was found to have a significantly greater risk for a young person experiencing homelessness. And what we similarly found was that once a young person experiences homelessness, this can lead to a range of impacts across a wide variety of domains. So whilst, yes, homelessness does have a very large impact upon a young person's mental health, it is, it extends far wider than that. There are impacts to a young person's educational or employment attainment, to social relationships, to physical health, to experiences of trauma. There is such a wide range of impacts that exist. It really outlines the need for early prevention and intervention measures to occur to ensure that young people never have that first experience of homelessness. But what can sort of harm these attempts to intervene and prevent homelessness is that a young person who has experienced homelessness is an increased chance of disengaging from services. As Kira so eloquently outlined, a young person has to deal with a series of service settings that don't necessarily respond to the wide range of challenges that might exist. They don't necessarily meet their needs either. And in addition, a young person is also navigating a new world as an adult or as an adolescent, and and this just increases the chances that they won't find the help that they might need at any given time. And the last of the key findings, and Nicola will talk about this far better than I will, is just the sheer importance of housing. It feels like a completely unnecessary thing to say, but any strategies, any responses to homelessness cannot be considered full unless they end up with the clear goal of having the young person obtain stable and secure housing. Now, even though this might be a very obvious point, it is not one that has necessarily been followed through by policymakers. Housing and homelessness responses will be considered in sort of one aspect, and mental health responses might be considered elsewhere. There isn't that integration that we might need to ensure that all of these issues are considered together. Thanks, Seb. So leading from these sort of key findings that came out through the report and the evidence analysis that we did, we developed a series of policy priorities to be considered for governments and policymakers in the future. In this presentation, I'm going to look at 3 key ones. These are not the only policy priorities that we discussed in the report, and feel free to sort of ask me any questions about what Orygen might have suggested, or I can send anyone the link to the report as well. Thanks, Seb. So the first key policy solution that we looked at was around an integrated approach to homelessness and mental health. As Kira's already outlined, and as I sort of briefly discussed before as well, it is not enough to think of homelessness and mental health as distinct issues, but nor is it enough to just approach them purely together. There are such a wide range of risks that lead to homelessness and impacts that stem from homelessness that there is a need for a much more global consideration of how homelessness is tackled in Australia, linking to the other key risk factors and impacts that arise for young people and people of all ages as well. So when I sort of talk about integration, there are sort of 2 main levels at which integration occurs. There is strategic integration, which is sort of a top-down policy approach to integration, and then there is service level integration, which is more of a bottom up, on the ground, helping young people with their needs. So in terms of strategic integration, our key recommendation is that the Australian government develop national guidelines around housing, homelessness and mental health. Currently, each of the states have responsibility for developing policies and procedures around these issues. And as you can expect, when there are 8 separate states and territories developing their own approaches, there is a degree of variability. Some states have implemented approaches which endeavour to integrate housing and mental health. An example being the sort of HASI initiative, which is developed in New South Wales and is being extended elsewhere. But then there are other states which have very distinct approaches where their housing policies will not even make a single mention of mental health or other risk factors. So this is why we need a bit of federal involvement to create at least a general set of guidelines that all states can follow and recognise the wide range of risk factors and impacts that can exist. So at a service level as well, one of our key recommendations was around trialling a centralised care coordination program for young people. This is something that's been picked up a little bit as well in the Productivity Commission's recently released report. I believe it was recommendation 15.4 off the top of my head. But care coordination is a program which looks at a more one-to-one assistance being provided to at-risk people to help them navigate a complex care system. It's a little bit of a slight bit of a band-aid solution in some respects, because a care coordinator is partly made important due to the complexity of the service settings that exist. In the event that service settings are simplified through improved strategic integration, then hopefully care coordination will become a little bit less relevant over time. But in the current situation that we have, it's a viable program that requires a centralised support base. Thanks, Seb. So the second key policy solution that we looked at was around improving service engagement. So as noted in our key findings, young people navigating a complex care system are less likely to engage with the services that they might need to help either prevent homelessness or intervene early in homelessness to prevent further experiences. So I'm going to go to that second dot point first, because I think this is the more vital one. And as Kira's said far more eloquently than I ever could, for any service engagement to completely be relevant to the population who needs it, in this case young people, it is vital for those with lived experience to be involved in the design of services. Without that, the services themselves are never going to quite fit the needs of the people who need them. And it's very encouraging to see recent work coming out of the Victorian Royal Commission especially, which is endeavouring to create a mental health body in Victoria which enshrines the need to hear those with lived experience and reflect their voices in the services that are designed. And this is something that really needs to be expanded nationally. But the sort of first point there is about developing a range of service approaches. Because when there is a complex service setting, any one response is unlikely to completely fit the needs of those who might want to engage with those services. So we found that there are strong evidence bases around outreach programs, which involves a care worker taking more proactive approaches to engage the population, whomever it might be, in the services that they may need. And we also found strong evidence bases around drop-in centres as well, which involve a method of service integration in that they provide linkages to young people to the services that they might need. But they are designed to be a stigma-free, 24-hour opportunity for young people to have their needs met and meet with other young people who might be experiencing similar things to them. Thanks, Seb. And the last sort of key policy solution I wanted to discuss, and I'll be a bit briefer on this one because Nicola will discuss it better than I can, is recognising that housing is a mental health issue. As I sort of briefly indicated earlier, without an extended examination of the needs of housing for young people in Australia, any responses to homelessness will fall short. And this starts with sort of the housing first ideal, which is that young people or anyone who experiences homelessness is prioritised to find housing as soon as possible, which then enables further supports to address the other underlying issues that may exist which have led to homelessness. But for this to occur well, for housing first methodologies to work in Australia, it requires addressing the shortfall in supported housing places around Australia. This is something recognised once again by the Productivity Mission, who outlined that Australia would need a investment of approximately $200 to $700 million to address this shortfall, which gives an indication about just how grave the shortage is around Australia. I was encouraged as well to refer again to the Victorian Royal Commission. They have provided recommendations themselves that that seek to address this this shortfall. They have, sorry, I'm just going to my notes a little bit. They provide for a short-term investment of 2,000 supporting housing places, but especially 500 support housing places for young people living with mental ill health. This is a really encouraging step and a great sort of first approach. However, what we are especially encouraged by through the Royal Commission is that there is ongoing allowances for continual reviews of supported housing places in Victoria to ensure that places meet the needs of the Victorian population. And we can only encourage that recommendations such as this are first of all enacted in Victoria, but then also provided for nationally as well. So that sort of concludes my presentation as well. Feel free to ask any questions. This is a relatively brief outline of what Orygen's considered, but yeah, look forward to hearing from the rest of you later. Thanks.
Thanks so much for that, Cameron. It's been really interesting as someone that got to discuss with you and advise previously on that policy paper, to see it right through and see the changes and things being actually implemented, especially as someone that works in the sector, seeing how my own work could take this on. Something I will mention that my work is doing at the moment is running a sustaining tenancies program. So people get into houses and they stay with that caseworker, and then there's a separate sustaining tenancies caseworker to prevent them from being at risk of homelessness again. So linking them in with the supports that they need, whether that's something that our service specifically can provide. As we've mentioned before, it is segmented, or other support services, and staying with them throughout their tenancy for as long as the tenant or client feels needed, and actually working with them to continue to be able to stay in that property and sustain that tenancy, so we're not looking at someone being at risk of homelessness again. So that's something I find really important. I also want to say thank you to Kira as well for sharing. There is a clear narrative set between both of those presentations, and you shared some really, really insightful points, so thank you again. I think we'll go on to our next speaker now. So that is Nicola. So Nicola Brackerts is currently the manager of AHURI Professional Services. She's a research specialist with over 15 years experience in a wide range of areas related to public policy, social justice, housing and disadvantage. Nicola has expertise in design, implementation and analysis of research in both academic and applied contexts, and has worked with a variety of stakeholders from the not-for-profit government and community services sector. Today, Nicola will be talking to us about some of the important housing policy considerations that are crucial to the discussion of homelessness and mental health. So I'll throw to you now, Nicola.
Thank you so much for that introduction, Winona. And also thank you, Cameron, for your great presentation, and congratulations on the release of the report. And also I'd like to thank you, Kira, for sharing your experiences with us. That's a really important point and viewpoint for us to include as well. Now, before I get started, I would like to also acknowledge the traditional owners of the various lands on which we meet today and pay my respects to their elders, past, present and emerging. And I suppose I should try and bring up my presentation. Let's see if the share screen works for me. Yep, here we go. So I'm going to be bringing the housing perspective to all of this. I think most of you are experts in the mental health field, but I'm going to focus on the housing perspective a little bit. And so the way I got involved with research on housing and mental health is I've been, well, as Winona said, I work for HURI, which is the Australian Housing and Urban Research Institute. And we have been partnering for some years with various organisations that work in the mental health space. And specifically, we've been doing a long-term project over many years with Mind Australia and also with Mental Health Australia. And we call this Trajectories. And Trajectories is called the interplay between mental health and housing pathways. And what we really wanted to look at there is how do people travel through the mental health and housing system? So what we know is, and I think Kira already mentioned that the mental health and housing systems aren't particularly well integrated. So even mental health itself is sort of divided into, you get your clinical side and you get your community-based side. In housing, you get your housing, and then you get, every state has a different kind of system. Then you get your various homelessness systems. So those systems aren't particularly well integrated at all. And so people who travel through those various systems, they experience various disconnects and gaps, and they can't necessarily access the help that they need. And so what we really wanted to do is understand, how do people travel through those systems? Where are the points where they can access help? Where are the points that they can't access help? And also try and identify points of intervention, so sort of areas where we could assist people to get help better. And so what we found in looking at that is, I should say it was a really big project. It was a national project. So we consulted with over 130 consumers and carers and people with lived experience all across Australia, in urban areas and in remote areas, with Indigenous people, with also, with all sorts of different kinds of groups of people from different cultural backgrounds. We also consulted with service providers in the fields of housing, in the fields of mental health. We also analysed quantitative data sets from a database called the Journeys Home database, which is about people experiencing homelessness, and the Household Income and Labour Dynamics Survey, which is like a panel data set of representative of the Australian population. But basically, after looking all of that and after all these consultations, what we really found is that the way people do experience their trajectories through these systems is that a lot of people are excluded, and that means that they can't access the kind of help that they need. So they might not meet the eligibility criteria, they don't have the right age, or they don't have the right, background, or they're not in the right location, or for whatever reason, they're excluded from accessing those services that they need. And then there's another group that are stuck, and they're stuck in situations that aren't suited to them. So they might be living in housing or situations that are completely unsuited to them, but they have no other option, so they have to stay there, they are stuck. Or they might be in an inpatient program somewhere in a hospital, and they don't have any pathways to move out of that, so they are stuck in that kind of situation. So that's another group that we encountered. And then another group that was really quite common that we saw again and again is, I describe it as cycling. Well, actually I initially described it as cycling until someone, one of our peer researchers said to me, look, it's not just a cycle where you go round and round and round and round. It's actually more of a downward spiral. So it's people who are cycling down. And so these are people who access help, don't get the kind of help they need, or it's not for long enough, or whatever it is, and then they drop out of the system again. And then something else happens and they need to access services again. They get some support for some time, then they drop out again. And so it's like a sort of these people enter into and exit the system, the various systems, various times. But each time when they enter and exit, their resources become further eroded, and they sort of actually lose something. And what this person I was speaking to said to me quite insightfully was, it's not like you get into the system and you regain whatever you've lost previously. So your resources get progressively eroded. So it's really a downward spiral. So that's sort of like really broadly the overview of what we found. So we also encountered some people who were well supported and who were in situations where they were able to stabilize their housing and mental health situation. But unfortunately, overall, those were rather rare occurrences. So looking at it from a housing perspective, why is housing important for mental health? So first of all, housing is a social determinant of health, and that really means that, the situation where you live and how you feel about it, and whether it's safe and secure and affordable and suited to your needs, affects how you are physically and also how you are mentally. So housing is a social determinant of health. And it's also really foundational for mental health recovery, in the sense that, people need a stable, safe and secure place to be so that they can access the services that they need, that they can access the help that they need, that they can build the social networks and social supports that they need, and basically so that they're integrated with their environment. So housing is really, it's not the one and only factor, but it's a critical factor that enables people to look after themselves, get better and stay well as well. And also to, once they are on a path to recovery, move on with other parts of their life as well, in a way that, mental health isn't the most critical, pressing thing in their life, or the ongoing housing security isn't that thing that is always on the forefront of their mind. People need a stable place to be so they can look at other areas of their life that they need to, that they would like to be involved in as well. That could be study, that could be making friends, that could be having other experiences, that could be all sorts of things. Now, while we didn't specifically focus on youth homelessness is something that came up again and again and again. And, you might ask, why do we focus on youth homelessness separately to adult homelessness or homelessness for older people? And I think it's in part due to the fact that what we found is that young people experience different kinds of challenges that are often to do with the developmental stage that they're at in their life, and that they're often due to the sort of fact that they might not yet have developed the experience and life skills that are necessary to navigate certain challenges. Often they don't have the financial resources backing them that an older person might have, or they might not have the job that pays as much as an older person might have. They might not, have developed the kind of tenancy skills, is what we call them. But this is sort of just, being aware of, who to call when something's broken in your house, when you need something fixed, or, what to do when there's a difficulty with a landlord, or, what kind of is expected of a person when they are renting a place, if they're lucky enough to have a place, in terms of maintaining it, or, who to ask for help. And especially, I think, with young people who are experiencing mental ill health, or very often young people who are homeless are very vulnerable, and they're not very well connected with their social networks or with their parents. They don't have a lot of people to go to assist them in sort of providing advice in those kinds of directions. So that's one particular developmental life stage that poses extra challenges for finding housing for young people. And the other thing is, as you're aware, very often mental ill health often emerges sort of at a young teenage or middle teenage stage in a person's life. So that's another stage that comes together sort of at that sort of kind of age specific stage. And then another thing that's really challenging, and that's sort of related to the way our systems are designed, as I've described as limitations and age transitions that impact on young people's ability to access and sustain services. And that's really when services have sort of age brackets. You know, we help people that are aged 15 to 18 or 18 to 21 or, you know, 18 to 25 or so forth. And so that can mean that a person might be well supported at one point in time or might have access to housing, but at a point in time, but when they move into another age bracket, suddenly they're no longer eligible for the kind of services that they had that were supporting them, and they have to either start over again or suddenly they find themselves without those kinds of services. Another example of those kinds of transitions is, you know, a young person might be homeless and they might be receiving mental health support while they're homeless, and they might be receiving housing and tenancy support while they're homeless, and then they become housed, let's say, in public housing tenancy, and suddenly their status changes in the system from being homeless to being housed, and they're no longer eligible for a number of supports that they had previously while they were homeless. So now they might find themselves housed, but without the support that they need. And they're like, oh, okay, I'm in here now, what am I going to do? And that again can put them at risk of not being able to sustain that tenancy and going back into that cycle. So how do young people become homeless? And I think Cameron and Kira, you've already mentioned several of these reasons. But one of the things that hasn't been mentioned yet is the fact that family conflict is a key driver of homelessness for young people. And I also want to reflect for a moment on what do we mean by young people? I think often it's sort of a catch-all for, you know, a really broad age group. It can be children and it can be young people. So, you know, family conflict might affect young people and children in terms of the fact that, you know, their family might break up and they might be accompanying a single parent who then becomes homeless, and that is their experience of homelessness. But I think for many young people also, it's the experience that they might decide on their own to leave their home, to move out of their home, because any alternative is better than staying within their home. So they're actually really quite different circumstances. But often this sort of kind of family conflict can be a driver for that homelessness. Other key risk points for homelessness are sort of transition points within the system, and that can be when someone leaves an inpatient unit at a hospital or is discharged from a hospital without, you know, sufficient planning as to where they might stay and without having a family that they can go back to. And they might exit youth detention or remand or other correctional institutions. Sadly, a really great risk factor is transitions from out-of-home care, where there's often, you know, insufficient planning and insufficient options for young people to go to, and perhaps also insufficient planning in terms of developing young people's skills and ability to look after themselves once they transition out. And often this perhaps, you know, expectation that bang, someone turns 18 and now they're able to look after themselves, which is really, I think, what most people wouldn't expect of their children when they're, you know, not homeless or not in out-of-home care, but that is expected of the out-of-home care cohort. And so what all of this points to is that parents are a really important source of support and advice for young people. And when there is an issue around that sort of parental support, it can be really difficult for young people to remain housed. And as I said, sometimes families can find it difficult to you know, deal with the difficult behaviours of their, or the challenging behaviours of their children, because maybe they themselves don't have the right support or don't know where to go for help. And that can also lead to tension and young people being evicted from the family home. So Cameron's already pointed out that, you know, there's a really strong link between homelessness and mental health. So mental health can often be something that precedes a person becoming homeless due to various factors. They can't keep the housing, or they decide to move out, or they get kicked out from wherever they are. But vice versa, being homeless is an incredibly stressful experience, and that can also lead to an onset of mental ill health in itself. So, you know, the longer a person is homeless, the more stressful it can become. Homelessness, youth homelessness also increases the risk of mental ill health at that point in time, but also due to the sort of adverse experiences of homelessness also later in life. And And what we also know is there's a really strong trend towards what we call intergenerational homelessness. And so that means when a young person has a parental experience of homelessness and they themselves experience homelessness as a child or a young person, they're much more likely to experience homelessness also as an older person. So it's really important to have effective interventions early on for homelessness to make sure that it sort of doesn't become an entrenched and intergenerational problem. And it's similar with serious mental illnesses. For example, there's research to show that, you know, if a first episode of psychosis is very effectively addressed, that really increases the chance of sort of a functional recovery later on in life. Sadly, we also know that our system is quite stressed and that often doesn't happen quite as well as it should. And it really limits people's opportunities to recover, you know, as much as they could. So what do we know about people, or what did we hear about people who are trying to access support? So especially among young people, we found that a lot of young people only seek formal support when all other avenues have been exhausted. And that can be due to a variety of factors. It can be because they feel shame. It can be because they don't know where to go. Obviously, it's also because those supports might not be available. There might be long waiting lists. They might not have insight into what's going on with them. There might not be people there to advocate for them and help them. So what often happens is that, you know, young people struggle on their own with whatever informal resources like their friends and family support that they have. And it's often only when all those resources are exhausted that they sort of then enter into a situation where they seek formal support. Another thing we found is that young people with complex needs, and when I say complex needs, I mean people, you know, with complex intersecting needs. This might be mental health, homelessness, alcohol and drug issues, experience of violence and other sorts of things. They find it very difficult to access housing. And I think the paradox here is that the more complex a person's need is and the more they are actually in need of assistance, the more difficult it is for them to get the assistance that they need. And I think both Kira, actually all three of you, and Winona and Cameron, you've already referred to the fact that, you know, you then have to go to different agencies to get help for different kind of things. They can help with this, but not with that. And this can often happen at a point in time where a person is already really stressed and finds it difficult to coordinate the most basic things in their life. And then they're also expected to sort of coordinate this sort of crossing across different kind of systems. And another paradox particularly from the housing side of this is that young people's ability to access social housing, by social housing I mean, you know, public housing and community housing as well, it's often related to age criteria. So, you know, you have to be a certain age to be able to sign a lease agreement. You have to be a certain age to be eligible for certain kind of supports. And paradoxically, this is not actually written down anywhere in any policy or so, but in terms of making allocations, like who is able to get public housing, for example, or community housing, a lot of housing providers think about young people as being a less good prospect as a tenant. And I think that relates to what I was saying earlier around the sort of, you know, developmental stage they are at, where they're not as settled yet in their kind of living skills and resources that they have to maintain that tenancy. So in terms of allocating those kind of social housing properties, they're often not at the top of the list. So that's another issue that makes it difficult to get in. And I think some housing providers also think about, look, if we give this young person housing and it's going to be a permanent housing allocation, and they're only really young, you know, they might be in there in 50 years. Do we want that? So these are just the sort of kind of things that sometimes I think might inform decision making. So in terms of what does this mean for policy interventions, and I think what came out again and again and again is that early intervention and prevention is really, 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 really important, you know, to stop the kind of things before a young person becomes homeless or becomes homeless for a long period of time. And there are several models that we know that work quite well. In the small print here, you see there's screening for risk factors at schools, coalitions of schools and services models. That's actually a really good model. So what the idea behind that kind of model is that the schools work with services in the area and they scan young people who are at that school for risk factors. And when risk factors are identified, those young people who are still housed, they're at the school, but they have those risk factors, they are linked within the supports that they need to address those risk factors before the person becomes homeless. And that's actually a model that's been evaluated and that's been shown to work quite well. So that is what I would call a prevention program. So that prevents before something has actually happened. Whereas early intervention programs, they target people at an early stage of, say, for example, a first onset of a mental ill health episode, or when they're homeless, and to make sure that they rapidly get back into housing. And so the first dot point here that I really wanted to address is sort of in terms of the way youth homelessness is sometimes dealt with, and that comes back to what I said earlier around, who are these young people who are homeless? So, for example, if there's a single parent who's accompanied by young people and children, and they might have experienced domestic and family violence or whatever, it is usually the adult who's at the centre of the intervention who gets the support, and children are sort of more considered as an adjunct. But I think what this focus on early intervention and prevention would mean is that you have to also consider the trauma experienced by the children and young people who are accompanying that adult, and target the interventions also to assist the young people. So that would be, I would identify that as a policy priority, to make sure that those interventions, address the accompanying young people as well. There are other kinds of interventions that you might be familiar with, like youth foyers, which are like a sort of a congregate form of living for young people that links them to education and training, and also mental health support, which works quite well. But, then there's again this sort of trade-off, like often young people are only admitted to a youth foyer if they're already considered to be housing ready and ready to engage in education and training and so forth, which then excludes that whole cohort, which is still struggling quite a bit. And I think I might be going over time a bit, so let's just sum up here. So in summary, housing is really important as an anchor for recovery from mental health. It provides security and attachment to the community and those social connections that are really important for recovery and maintaining mental well-being. Formal supports can help young people access informal resources. Early prevention and intervention are incredibly important. And that's pretty much my main point. Okay, thank you very much. Sorry about it being so long.
Thanks, Nicola. I think you were actually right on time. Worked out well. Awesome. So the next speaker is Sebastian. Sebastian is a policy and research officer at the Youth Affairs Council Victoria, which is also known as YACVIC. Specialising in housing, youth participation, disability, and rural and regional issues. He's an expert at elevating young people's voices to inform better decisions by providing appropriate support to young people and setting up structures of youth participation. Seb has worked collaboratively with dozens of young people experiencing homelessness to identify and advocate for their top solutions to end youth homelessness. And I will throw over to you, Seb. Thank you.
Fantastic. Thank you, Kira, and thank you, Cameron and Nicola and Winona. It's a pleasure to be speaking here today. Before I begin, I'll acknowledge that I'm zooming in today from Wurundjeri country, north of Melbourne, and pay my respects to elders past, present and emerging of the country that I'm on, and then also the countries that you're zooming in from today as well. This land was never ceded, which means it always was and always will be Aboriginal country. I'll keep this section brief. It's more of an invitation and an update as to what's happening in the youth homelessness space in Victoria. There's lots happening this year, which is fantastic. It's keeping me and my colleagues in the policy and advocacy space very, very busy. There's a handful of things I'll talk about, and I'd invite you to chat with me more after today. I'm going to put my contact details, send them to you, so we can collaborate on some of these advocacy and policy issues that are coming up. I'm also going to put a couple of links in the chat here. So if you want to find out more information about the things that I'm talking about, feel free to do that now or after the session. So I'm sure you all know about the Big Housing Build, which is the Victorian government's massive spend on social housing in Victoria. It's the biggest kind of spend in recent history, and it's really exciting to see stuff like that happen. Part of the strategy that they're putting together to direct the Big Housing Build, which is funding for 4 years, they're putting together a strategy which is a 10-year plan for social and affordable housing in Victoria. That's sitting with Homes Victoria at the moment. It's a big opportunity to shape what happens in this space, in the social and so public and community housing space in Victoria. They've just closed applications for submissions from organisations, but I did notice this morning that the website is still kind of accepting submissions. There's an email address there as well. So if you do want to make a last minute submission as an organisation or as an individual community member, I'd really encourage you to do that now. YACVIC and all of our collaborators in the sector have made submissions last week, encouraging the government to be thinking about young people as a top kind of priority. As Cameron said, young people are overrepresented in the homelessness statistics. I think even in Victoria, it's even worse. So it's about 16% of young people. 16% of the population in Victoria are young, but 26% of the homeless population are young. So it's almost young people are twice as likely to experience homelessness, but they're very, very rarely given access to public or community housing. There's some technical details there, which I'd love to talk about, but now is not the time. But if you'd like, you can read our submission, which we've put in, and the submissions of other organisations in this space. We are going to launch our submission on Youth Homelessness Matters Day, which is the 21st of April. So you can read it then. Also on that day, we'll be sharing a petition that Everybody's Home is running, which is directed at the Federal Minister for Youth, Alan Tudge. They're kind of, the point of that petition is just to put youth homelessness on his agenda and to get the federal government to commit funding to build social and so public and community housing, specifically for young people. So if you, as an organisation, would be happy to share that petition as well, I'd love to hear from you. Get in touch. My email's on the bottom there. I think obviously the more people we get signing that petition, the better, but also the more diverse kind of sectors that those signatures come from, the better, and the more impactful that is as well. The second link that I've put in the chat is about the Victorian Parliamentary Inquiry. So this was a process that the Victorian government went through last year, and the final report has just come out. It's the Victorian Parliament's inquiry into how the homelessness service sector works and what recommendations they have for change. They've made a very clear focus on young people in that report, which is fantastic to see. And they've demonstrated that they've really heard from young people experiencing homelessness. And YACVIC, one of my colleagues, Eva, has written a fantastic analysis and summary of that report. It's very long. I won't encourage you to read the whole thing, but all the important details are in that second link. So please have a look at that. What we see from that is some really important recommendations about how the service sector works. The ongoing piece will be around encouraging the government to take up the recommendations. They've got 6 months from when the report came out, which was in February this year, I believe, to respond to the recommendations. So we'll be advocating with politicians in the Victorian government and decision makers to make sure that all of the important recommendations are taking up. Love to chat with you if you're interested and available about aligning our advocacy and communications with government on that process. The third link that I've put in there is around the recent changes to renting laws in Victoria. So the Residential Tenancies Act amendment. I'm sure you would have seen some important changes, steps forward in the way that people rent in Victoria. It makes things fairer for tenants and also makes it easier to get things or deal with issues as they come up. That's how I'm going to frame it. But yeah, some really important changes there. 130 new regulations, including the introduction of minimum standards, which haven't been a thing in Victoria yet. So now rental properties have to have a functioning toilet and a functioning cooking area and windows and doors that lock. So things that we would think are, basic, but they needed to be written down in the law. So some really important changes there, and you can look at that link to find some of the details. I'll do a little plug for a webinar that YACVIC is running with VCOS, the Victorian Council of Social Service, within the next few weeks, which breaks down some of this these changes to the renting laws, specifically focusing on young people and what the changes mean for them. And I'd love to see some of you or some of your colleagues there, because I think there's a really important role for the sector to support young people to know what their rights are in housing now. You know, they're changing over time, and then how to have their rights met through the processes, through VCAT, through Consumer Affairs Victoria. So look, that's enough from me. I'd love to chat more with you. So please reach out if you'd like to collaborate on any of these advocacy or policy issues that I've talked about, and hopefully see you at the webinar that I'll run with VCAS in the next few weeks.
Thanks, Seb. It will be great to sign that petition. And thanks to all the presenters today. We've got a lot to talk about, and we've had, you know, a couple of questions come through that we're looking forward to talking about. And please feel free again to put questions, reflections, just comments or anything that you wanted to share as well. Feel free to put that in the chat, or, you know, when we start the Q&A, take your mic off and just say it. So I will throw it over to you, Winona, to lead the Q&A bit.
Awesome. Again, thank you to all the speakers. It's been really insightful to hear the differences again from New South Wales to Victoria, and seeing what things I can actually grasp onto and take back to my work, which I will do this afternoon. We've had one question come through from Christine in regards to how it is youth homelessness is a family issue and community trauma issue. I was just wanting to know if you want to speak more to that, Christine?
Yeah, thank you so much. And sorry I was on audio before, I've just joined on video. Thank you to all the presenters though, really, really informative and useful presentations. I guess I'm just really aware of how we often make the issue an individual issue, and I think it's really important that we have both kind of the short-term goals of making sure we can provide really suitable housing for young people, but that we also, as a community of practitioners and a society, we look at how the problem is located within trauma of families and communities, and that and I know I shy away from family work sometimes because it is very difficult, but how can we put more focus on reconnecting young people with families and communities? Because I've had some young people who for years have been placed in youth housing and have received a lot of support, but we're actually filling a gap. We're actually trying to replace what the young person needs most, which is connection to family and community. So just, yeah, really just people's thoughts on that, and how, you know, our funding is often really let's fill in the gaps, but not let's look at how we can, in the next 10, 20 years, try and prevent this through supporting families.
I'm happy to, excuse me, thanks a lot for that, Christine. With regards to sort of family connection, in terms of what Orygen looked at, I like to think of it more as social connection, right? Because it's important to recognise, obviously, that individual young person's experiences are their own, and for every, for young person, family connection might not be appropriate or available given their circumstances. So but I agree wholeheartedly that connection programs, however they might look, are vital in helping both prevent homelessness but also respond to a young person's experiences, because yeah, having strong connections around a young person of any age for that matter, is a protective factor, and can provide important support networks that both help elevate someone from experiencing homelessness, but also provide that assistance when they might need. So yeah, definitely agree that there needs to be a focus on that in any policy approach. In terms of the sort of broad range of factors that needs to be considered in responding to homelessness, yes, my presentation talked about sort of housing as a mental health issue, but that is a little bit of a, to be honest, a bit of a shorthand that probably reflects Orygen's remit as a youth mental health focused advocacy and research translation group. Truly, for any policy responses to homelessness to be most effective, it needs to capture the wide range of risk factors and impacts that arise through homelessness. And yes, mental health is a key aspect of that, but so is trauma, so is social connection, education, employment, AOD, and I'm probably just scraping the surface a little bit here as well. But yes, all of these factors and more need to be captured in any truly effective response.
Great point, Cameron. I'd like to add to that as well, like just going back to what I said before, like asking the young person what they want, like who do they see as their family, who do they see as their community, connecting them with culture as well. I think that it can be really hard with young people not having stability in place or people, and then also on top of that not knowing their culture and where they're from. And I think that it can be a massive support, and find your sense of belonging to know about your culture and what are your traditions and stuff like that. And I think that that really kind of goes under the radar and doesn't get seen as a priority because it's not in crisis, but I think long term that can have a really big impact on a young person. Also, like asking them what they want in their housing, like do they want to be back with family, do they want where do they see their housing goals? Do they want to be in a private rental? Do they want to live in a share house? And then even if, for example, with like care orders or something, like if they can't go back to family right now, not saying, oh no, you can't do that, because when they're 18, they can go back to wherever they want anyway. So you're just saying, okay, that's great. How can we make that safer for you? Or how can we support you, to get to wherever your goal is? And then I think as well, not having that strict criteria of having to be in crisis to get the support you need. So having that community and that family, whoever they see as their family, that support beforehand, before it gets into crisis, which I know the system isn't really great at that kind of prevention and early intervention stuff. But yeah, that would be my 2 cents. Seb or Winona, do you want to add anything, or Nicola or Andrew?
I really just want to echo what you're saying as well, Kira. So one of the really key things that came out of our research in terms of, policy recommendations, or what people really want, like it was all the top thing that came out is that people want choice and control. And that's, having, it's exactly what we said, being asked, what do you want? And then actually having the options available to make that happen, and not just say, look, there is this one room in this location that may or may not suit you, or living with these people who you may or may not know or like. That's your one and only option, So it's being asked, having a choice, and having some control over, where and how and with whom you live. And that's really important. And I guess we all know that the way the system works at the moment, it's, you have to be in severe crisis, and it's very resource constrained, and usually it's people should consider themselves lucky if they're offered any kind of housing or support at all, and that is not the same as choice and control.
Did you want to add something, Cameron? I was just going to put in the chat with my Why Change work that I do within Berry Street. We put together a submission for the inquiry into homelessness in Victoria, and I just wanted to share a quote with that, which kind of perfectly, is aligned with what you were talking about, Nicola. We are made to feel grateful for what we have, even when it's broken. And it's like, you should just be grateful for getting any sort of housing, even if that housing in the long term is going to be detrimental to our mental health recovery or AOD recovery. And, it's not the best option for us, but we're still, but at least you have a roof over your head. And I think that we can do a lot better than that.
I think so. And that reminds me of many instances that I've heard where the actual housing that a person's actually allocated makes the situation worse. So, a young person is so inappropriate, might be put into a boarding house where there's a lot of violence and a lot of noise and a lot of unrest. And that really, they feel unsafe, and it can really make their mental health a lot worse than it was to start off with. So, just having that housing isn't necessarily a positive thing. And so, it comes back to, having appropriate options that provide some sort of choice. And when I say options, like actual options rather than just here you go.
And and then not letting the worker decide what they think is best for the young person, but letting the young person decide what's best for them, because they have their own priorities. Like, we have our own things that and a different perspective as well. Like, you may see one thing as a priority, but we may see another thing as being more important that would help us.
I think that goes with what you said before, Kira, that young people are experts in their own lives. They are the ones that know they need the guidance, but they don't always need someone to tell them this is exactly what you need to do. They need the options, they need appropriate allocations, which is something that, again, everyone said that, and I echo that completely, that isn't something that is always offered. They're sort of, here's a house with a roof over your head, ta-da, that, as if that's a band-aid fix for everything, but it's not appropriate if they are experiencing AOD or domestic violence or anything like that. It may not be an appropriate area for those people to actually be in, and it is detrimental to their long-term mental health. Is anyone else wanting to speak to that, Seb or anyone? Awesome. I'd just like to throw to Andrew for your question.
Yeah, sure. It's a good segue, actually, talking about all of those different elements and all those different sectors and how they sort of integrate, because the question is about service integration. It seems like so much of what we're talking about today is like going from, the system where particularly we're talking about today, homelessness and youth mental health, the two systems are treated in isolation. But we've also mentioned all these other systems and sort of elements that need to be integrated in as well. And it seems really obvious, hey, when we look at it now, it's like all these things should be integrated. They all affect each other, and we need all of the systems and all the people working in those areas to talk to each other. But clearly it hasn't happened, and it is still not happening that well in a lot of circumstances. So I guess I was just wondering, from all of you, is what sort of looking at like where we've come from and where we're going. So what have been some of the challenges to integrating all of these different systems? Is it mainly at a governance level? Is it something? Is it sort of really policy driven? Is it a sort of capacity thing at a staff level? Where are the gaps, and how do we sort of overcome those? I was just wondering if we could hear a little bit more about that. I don't know who wants to start with that big question.
I'm happy to start off with a comment on that. And I'm sure you're all aware it's not just one particular thing. There are the different kind of government silos who is responsible for making policy and this and that and the other. But I mean, I suppose one of the key things I always think it's around the funding, and it's not just how much money there is, it's who is funded to do what and under what kind of, what are their accountability mechanisms? Like, what are they funded to do? And I think as long as funding is allocated separately for housing support, for homelessness support, for clinical support, for community mental health support, as long as that's not an integrated sort of funding pool to provide a person who has a set of needs with the right supports that they need, and they're all funded through the same kind of pool of funding, it's going to be very difficult to make really long-term, I think, structural changes as to how those services are provided. Because I guess my observation has been that often at a local level, there are very good initiatives between the services to coordinate and to communicate and so on. And there are some initiatives sort of also at the state level, but much more isolated. But really often it is really just about, we've got funding to do this and you've got funding to do that, and we're not going to do this because we're not funded to do this. So yeah, that would be my main observation there. I'm sure someone else has another perspective.
Can I add to that? I agree wholeheartedly. And I think sometimes as organisations, we actually fall into the trap of just bowing down to what funding expects, or also putting in proposals to fit the funding structures and requirements rather than challenging them and saying, this is actually not what the work needs to be. The work looks like this, and this is the kind of funding we need. But, you know, we're all, because it's so competitive, because it's limited, we take what funding we can get, but I think we then deliver programs that are not, they're not the best at times, because we've just tried to meet the needs of the funding body rather than the needs of the client.
That is so true. And I think you see it again and again, you know, funding becomes available for a certain model or something, and suddenly everyone's doing it because that's where the money is. And vice versa. Sometimes, you know, you get fantastic pilot projects that have really, really great outcomes, but they're a pilot project, and then for whatever political or other kind of reasons, they don't get continued, and then the funding gets, and then everyone runs in that direction because that's, you know, that's where the money is.
Yeah, great points, Nicola and Christine. Thanks for that. I think you're right. Funding is a major part of this issue. And I'd just add one more thing to the mix, which is around the length of funding times. So organisations get funded to run a project for 9 months, 12 months, even 2 years. But because there's a finish date, no one in that organisation can do meaningful collaboration or you know, make connections with other organisations working in the same local area, potentially on different issues, to collaborate there. So, and that's something that we've been thinking about as the peak body, is around how do we improve the way funding agreements are delivered, especially in terms of the getting longer term funding to enable all of those other parts of the work that needs to happen, especially around that collaboration bit.
I think I'm pushing back on their expectations for outcomes that we can quickly fix or resolve, you know, a young person's 10, 15, 20 years of complex issues in a 12-month period. And we kind of buy into that, and we say we can, but we know that this is long-term work, and we can only do this bit of the work in this 12 months with that young person.
It's a great point. I think in a lot of my work, I do lived experience and then translate that into policy. And that submission that I put in before, I forgot to say, it's built fully by people with lived experience of homelessness. And we did it in a way so that it was accessible to everyone. Because often policy is done about young people and we can't even read it, and it's not accessible, we don't understand it. And when we were doing the Victorian Youth Strategy, and that was like really broad, and it was just so overwhelming to look at all the different problem areas and issues. And I think that can be a really big barrier to looking at it holistically, because it's just really overwhelming and seems like, you know, there's so many issues that nothing can be done, and there's so much work to go, which there is, and that can be a barrier to working together, because there's just so many different things that we need to focus on, and it's hard to prioritize, I guess. Did you have something you wanted to add to that, Cameron? I know you took the mic off before.
Yeah, I'm just going to add another point in the mix. Agree completely with what's being talked about. I think, yeah, money is forever and always probably going to be the key indicator of how a particular set of policy changes move. But I want to throw in the challenges of information sharing as well, because when we speak about the difficulties in progressing a fully integrated service and strategic response to homelessness, we will inevitably face challenges in how to deal with information. And we've sort of seen this just in one perspective through how the My Health record rollout occurred, in terms of trying to make information available across the health sector. And this is obviously just one sector, and to respond to homelessness well, it would need to have a rollout across a wide range of sectors. From both the information technology perspective, a privacy perspective, it is possibly one of the greatest challenges that we've faced in terms of really developing a well-integrated response, because ideally, in a perfect world, a caseworker, case coordinator, whomever it is who's dealing with the young person, would be able to immediately and easily see a safe outline of what might be going on to ensure that their advice meets the young person's needs. And I think we're a very long way from that happening, unfortunately.
Just jump in with a quick follow-up, because it's obviously very multifaceted, but one thing that seems to be everyone seems to be talking about is that funding side of things, and I'm wondering what people think it would take, because it feels like it's still like we've got this sort of the Royal Commission into Mental Health, and we've got these inquiries into housing and homelessness. What would it take to sort of have a more integrated funding and policy mechanism? And are we seeing this in these reviews, or is it just even with this sort of understanding that things need to be integrated, is still a little bit more of the same? And maybe just to focus the question, are there good examples, case studies of funding integration working across portfolios? I'll take that as a no.
That's a very big question, Andrew. Happy to start us off, and if anyone wants to jump in, absolutely do. I think that the kind of foundational piece to make this happen is a bit of political bravery more than anything else. Like, decision makers are so focused on winning the next election, or as we've been talking about, meeting those kind of KPIs. And I think there's a bit of work in there from us as a sector to encourage those decision makers to be making these kinds of shifts in the way that they see funding and see their role in supporting the sector to be doing this kind of work. But yeah, beyond that, I'm not sure what that looks like.
I think also really strong partnerships between the agencies doing the work with young people. I think, so we were funded last year at Foundation House for a very small, again, project with at-risk African Australian young people, where it was built into the model that we would do networking with the other partner agencies, we'd do regular care team meetings, you know, the young person would be at the centre of that work. But as Nicola mentioned, it was a pilot project. And then at the end of that, no one really fought for it, not within the agency, not outside of the agency. So we need some really strong allies and advocates to really push for that work to continue. And those relationships are stronger in terms of, this is just in the southeast of Melbourne, between those youth agencies. But the funding disappeared. So, yeah, it kind of needs a real commitment from within and without a particular agency or program.
I'm not sure if this exactly answers your question, Andrew, or if I'm going on a bit of a tangent here, but I feel like a lot of the time young people aren't trusted with finances, so there'll be these support packages out there and funding for young people, but we aren't told about them, and that's kind of just held by the workers. And then instead of being transparent with us about like how much it is and what we can use it for, and then also letting us decide what we need the funding for, it's kind of held with the workers and with the organisation. And then there's also that need for young people to learn how to navigate those systems and learn how to know what to ask for, or else we just don't get, what we're entitled to, because that information just isn't transparent with us.
Yeah, sorry, I just had to look up something there for my silence. I remember a little while ago we had a look at something, and it was rolled out in the UK, and it was called a joint commissioning model for funding. And basically they had pooled funding across several agencies, and that reported directly to Treasury rather than the various portfolios. And that, I don't think that's going anymore, but that was one initiative that had been trialled, and that in a report several years ago I referred to, which is why I couldn't remember it straight up. But yeah, so there are some models that have been trialled. But so really it's about, where does that accounting for the financial expenditure, and where do the KPIs, where does that all get reported to, and who is it? And so obviously if you go to Treasury, it sits above all of that, and you have the pooled funding across the various agencies in the various sectors. So that's one way of doing it.
Awesome, thanks, Nicola, and also, yeah, just thanks, Kira. That was a good sort of balance between that high level funding and then like more in the local sort of in the moment for young people as well. So thanks both. Cameron, were you going to jump in?
Yeah, well, I was going to try and speak briefly to a good model, and I'm going to refer to Finland. They were, or are, at least as of about a year ago, the only nation in the EU that has actually seen a reduction in homelessness rates over the previous few years. So I'm far from an expert on the sort of Finnish governance and funding model, but they've set aside distinct policy areas to deal with homelessness, have enshrined housing first principles at a government and a strategic level, but also quite importantly, and a key theme of the discussion, they've very much emphasised, what's the term they use? I think it's evidence by experience or something along those lines, which is the idea that at all steps of the policy formulation and review process, the voices of those, excuse me, who have lived experience or scientific knowledge in these areas, those voices are emphasised to drive policy solutions, and they are funded accordingly. So by doing that, I think it removes some of the sort of political necessity for short-term responses, short-term effective responses, and leads to a more sort of viable and efficient utilisation of public funds as well.
Yeah, thanks for bringing up the Finnish model, Cameron. That's it's actually a really they call it housing first, but it's not the same kind of housing first model as they use in the US. So it uses the same words, but it's not actually the same model. And the really interesting thing about the Finnish model is that they've actually done away with all of their crisis accommodation. I think they've only got like one super duper emergency crisis shelter somewhere, because they put everybody into long-term housing straight away. So people don't get shuffled around crisis accommodation because there is none, they haven't got it. But part of what made that possible in Finland is that at the time when they introduced it, they had really good political backing, and there was, a minister that was really supportive of that and supported that with finance and with political support and so forth for a number of years to make that happen. So that comes back to, I think someone or a couple of times it's come up, it's not possible, it's too hard, it's too this, it's too that. I mean, I think the Finnish example shows that it is possible. I think also what really shows what's possible is the COVID response we've seen over the past year, where a lot of things that many agencies have been asking for and policy advisors have been, hoping that might happen, that were always put in the too hard basket, suddenly became possible for a period of time. Now suddenly they're too expensive, too hard, too whatever. So I think it's also around not being discouraged and being blocked by any kind of notion that things are not possible, or policymakers saying it's too hard, or we can't do it, because I think given the right kind of backing and the right kind of support, a lot of things can actually be done.
And that was a really, really good point, Nicola. I'm actually really intrigued to learn more about the Finnish model and everything like that, rather than looking just Australia-wide, looking further into what we can do. I'm very conscious of time, though. It's been a really, really great meeting, and I feel like we could talk all day about this. While we have come a long way in Australia, there is still such a way to go. So meetings like this are really, really important to keep that conversation happening, both in Victoria, New South Wales, and Australia-wide. I would like to say a big thank you to everyone today for coming, as well as thank you to everyone that's presented and spoke to questions and everything like that. Before we finish, I'd like to remind everyone that they can join the community of practice by accepting the invitation that's going to come out a bit later. And also, if anyone's feeling like they're needing a bit of mental health support or anything like that, Andrew has just shared some contact details in the chat, and I think it's really important this afternoon you look after yourself and take some time to do something that is a bit self-care and be very mindful of your own mental health. Thanks again for everyone joining, and I hope you really enjoyed it, and I look forward to seeing you at the next one.